this is gonna be cream, so a topical cream. So the first thing we're gonna do is wash our hands and put on our gloves. Then we're gonna go to our medical book and we are going to identify our patient. This is Stephanie, this matches, this is Stephanie. So then we are gonna go to our MAR and we are doing hydrocortisone cream. So apply to the rash on the left wrist every day. Dr. House for dermatitis. And then we are going to go into read our order, make sure our order match. Hydrocortisone cream applied to the rash on the left wrist every day for dermatitis. Dr. House. Okay. And then we are going to go into our med storage thing here. Take out our medicine. Perfect. Okay, so now we have our medicine out of our lockbox, so we are gonna do our first check. When I say first check, I mean we are checking our label to the MAR. Okay. So I'm going to check hydrocortisone cream. Hydrocortisone cream applied to the rash on left wrist every day at 12 p.m. For dermatitis. Okay, so we do not have to shake this one. We take it off. Put your lid upside down. And you're going to squirt a little bit into a medicine cup, how much ever is indicated, depending on how big the rash is, or how much the MAR tells you to. So we got our medicine in our little medicine cup. Okay, then that's prepared. So we're going to do our second check. Hydrocortisone cream. Apply to the rash on left wrist every day. Okay, so that was our second check. So now we are about to give this medication. So we're going to do our third and final check. Okay, hydrocortisone cream. Apply to the rash on left wrist every day. Dr. House, this is for Stephanie. Okay, so that was our third and final check. So we're going to put this back in its appropriate bag, and we're going to walk this medication back up. Okay, and we're going to go over to Stephanie. Hi, Stephanie. This is your cream for your rash on your left wrist. So you're going to make sure you have her left wrist exposed. So we're gonna, if it is dirty or is it oozing, you're gonna take a napkin and clean the area. And if it is, you need to wipe from the inside of the wound to the out or the opening. In this case, Stephanie does not have oozing anywhere. So we are going to directly put the medication on her left wrist. There you go, Stephanie. Okay, don't pick at that, and I'll come back and check on you in 30 minutes. Then we're going to come to our MAR. We're going to take our gloves off and wash our hands, and then we would document.